Welcome to Hypertension course, in which we are going to see many topics in hypertension, starting from the pathophysiology, the classification, the investigations, management, and some other topics like resting hypertension. So, we are trying to cover the entire aspects of hypertension in this course. So, to give you a brief introduction about hypertension today, not only in developed countries, but also in developing countries, the hypertension is the leading cause of death. So, although the countries have developed, they are not able to reduce the mortality rate and morbidity due to hypertension. And we look at the Indian scenario, at present the prevalence of hypertension is around 30 or 33%. 1 in 3 of every Indian suffer from hypertension. The problem is only 1 in 3 knows that they have hypertension. In that, only 1 in 3 getting treatment for hypertension, but they do not have control of blood pressure. So, net result, almost only 12% of Indian hypertensives have controlled blood pressure. So, as I told you, the hypertension prevalence is almost 1/3, 33 to 35%. And what is very important to realize is the complications of hypertension. In India, the stroke deaths are more than coronary heart disease due to hypertension. So, that's a very bad news, because when compared to coronary heart disease, stroke has got higher morbidity, mortality, less treatment options, and success when compared to coronary heart disease. That's why, as you know, in treatment of hypertension, our aim is to prevent strokes. For that, meticulous understanding of hypertension and the investigations as well as the management is very, very important to prevent strokes as well as coronary heart disease in hypertension. What is other important parameter we have to understand is this. So, I told you almost 1/3 of our patients are hypertensives, and 50% of our population are waiting to become hypertensives, because as you know, 130 to 140 is called high normal pressure, or some people call